I'll just give you this tiny little microphone to talk to.
Okay.
Perfect, right there.
Okay.
Nope, I'm a little short. Okay.
Ready as ever be.
My name is Gloeli Calderon, but I go by Glow, and I am from Austin, Texas.
I'm from Birmingham, Alabama.
Las Vegas, Nevada.
Seattle, Washington.
Long way from home, but glad to be here.
I'm currently pursuing my bachelor's in nursing, and I'm a senior student.
I am literally at the halfway mark.
I'm super excited because I'm almost done.
Just passed my NCLEX, so glad to have that done.
The end is so near.
I'm currently applying to nursing schools right now, so.
I'd already been a CNA, and I thought, how can I better help the people that I already help? And it's to have more knowledge, better skills. It's to be in a position where I can advocate for them.
Just answering the altruistic call to help people, my community.
All the different ways it impacts people around the community. And so I wanted to do the same thing because I always had a passion for helping people.
I know that's the typical response, but that's really what I wanted to do.
So funny story, I'm actually in the Army National Guard. I wanted to be a mechanical engineer, realized I really did not like it. And I knew I always enjoyed healthcare. I was one of those people watching Grey's Anatomy.
Grey's Anatomy was my show. Like when I was growing up, I was like, hey, that's gonna be me on the stretcher giving CPR.
I started shadowing and realized that it is the only profession that was truly holistic in healthcare.
Then my grandfather got diagnosed with cancer. Watching the nurses who actually helped him just gave me a whole different outlook on patient care.
I'm going to be a cardiac ICU nurse. I'm currently externing at a hospital doing it, and I'm in love. I'm in love.
I want to eventually be a flight nurse, so I want to start in ICU because I want that continuation of care mindset.
I really like critical care nursing, and I also am really, really interested in emergency medicine.
Emergency medicine's got my heart right now.
The emergency room.
I would love to work in an ER someday.
I got the opportunity to work in the NICU. After that, I was pretty much set about pediatrics.
I'm interested in pediatrics or
Psych nursing.
Oncology.
I'm thinking of specializing in cardiac or emergency nursing.
I am still considering all of the possibilities for nursing.
I don't even know what state I want to work in at this point. I think it's just about exploring our options and, making sure that we make that informed decision.
about the kidneys. Oh my gosh.
Kidneys. Tell me
What do I feel about the kidneys?
Oh, Lord, you got me quite, see, put me on the spot.
Well, kidneys are wet.
The washing machine of the body.
The kidneys are my friend. You know what?
The kidneys get rid of all the things that I don't need that I still put in my body and I know that I should not.
They filter the blood. You're asking me test questions.
When we look at kidney levels, we look at your bun, your creatinine. Definitely want to know what your potassium is. What else?
They play such a huge role as a clue to the body.
The kidney and the heart are like really connected,
Yes.
that too.
Yes.
They're just as important as the heart and lungs are. They're what filters everything.
We're missing something.
You can live with one kidney, did you say that?
It's nice that we have two, also just because we can give to someone if they need it.
You can be able to change a life with that too.
Yeah. Yeah, I think we covered. Yeah.
Nephrology nurse, is that a real thing?
I don't know about a nephrology nurse. I didn't even know it was a thing until like today.
I just really didn't know a whole lot about it, I don't reckon. It's not really a common specialty that's talked about, I would say.
You hear about all these big specialties like ER nurses.
ER, med-surg, pediatrics, etc.
Of course, we go over all the different systems, but there isn't an emphasis on being a nephrology nurse necessarily, which is interesting because you learn that that's one of the first organ systems to go, one of the most important.
I'm not quite sure what it entails, but I'm interested in learning more about it.
My mom was a dialysis nurse for many years, and I love how she was just able to like build relationships, and you get to like be there in their victories when they get that kidney transplant.
That's amazing. I never thought of that.
I mean, I never really thought about it. I see why it would be important to make it more well known to everyone, especially students that are in that part of their learning process and just thinking about what to do for a career.
Thank you very much.
No more questions. No more questions. No more questions. No more questions.